Thank you. It's an honor to be here. Today's paper is a collaboration between Dr. Sutomo General Hospital and Faculty of Medicine Airlangga University and Hang Tuah University in Surabaya, Indonesia. Today, I will be talking about the psychiatric aspect of healthcare workers in COVID-19 pandemic, the prevalence of anxiety, resilience, burnout, and the correlation to stress biomarkers. Please allow me, Danya, to speak on behalf of our main author, Dr. Marga Maramis. This is the outline for our presentation today, and let's start on the scope of the problem. So the rising of the confirmed COVID-19 case overwhelmed hospitals all across Indonesia, especially our hospital, Dr. Sutomo General Hospital, as the biggest referral hospital in Eastern Indonesia. This situation affected our healthcare workers, including our residents, and giving them mental and physical exhaustions. There's an anxiety about contracting the disease, the pain of losing colleagues, the pain of losing patients, having to take difficult decisions affected them mentally and physically. So this situation arises some questions. We know that this is indeed a very stressful condition, but how many are we talking about here? What about the prevalence of burnout and anxiety amongst our frontliners, and how severe it is? Does it also affect them physically? And if so, which biomarkers serve as a potential biomarker for stress? And does exercise-based intervention has any impact on this population? So based on these questions, we conducted a research using online questionnaires and biological sample, in which the online questionnaire, we use a psychological questionnaire like STAI for anxiety, BRS for resilience, and MBI for burnout. And then for the biological sample, we took from blood and saliva to obtain data around cortisol, CD4, interleukin-6, and neutrophil to lymphocyte ratio. All of data above will be analyzed by using SPSS software to see if the P value is under 0.05, it will considered as a significant data. And here we see the research and trial flow process. So all of our research is conducted in Dr. Sutomo General Hospital between May to June 2020. The sample are from Department Anesthesiology and Internal Medicine, which 61 of them meet the inclusion criteria. They are all working on the isolation room as special for the COVID-19 patient. And from this, we took the baseline data from them, the online questionnaire and the biological sample, and then we are using the randomized control trial to see whether there are difference in control and intervention group. The intervention group will receive a Zumba exercise intervention. And after that, after 2 weeks, we will examine took another online questionnaire and biological sample. These are the demographic data that we obtained from this study. Let's see the result. First of all, the result of psychological markers. So in here, in the table, we saw that there is no significant correlation, there's no difference between the socio-demographical groups in here at the beginning of self-isolation. And also, after self-isolation, there is no significant data also. All of them showing almost similar pattern. Let's look in depth on each of our psychological questionnaire. The first of all, let's start from the state trait anxiety inventory. So, state anxiety is the present subjective feeling of fear. Meanwhile, the trait anxiety is considered as a baseline, more like a personality that won't really change over time. And based on these two questionnaires, we found that the resident physician has both the trait anxiety and state anxiety, and showing that 27.9% of them have high state of anxiety at the beginning of self-isolation, and it persists in 19.7% of the population after self-isolation. And this may due to the fact to some contributing factors such as the stressful medical residency, adding the weight by the pandemic, there's a worries about getting infected at work, extended rotation period, lack of PPE, and inadequate testing. And so we must address there's 1 in 3 residents have high level of anxiety. And for the demographic factors, we found there's no significant correlation between the state rate anxiety and socio-demographic factors. But it is actually contradicts to previous study, which shows that there's a higher level of anxiety in female gender and depression amongst healthcare workers during the COVID-19 pandemic. But even so, less was known on how the gender was able to affect the time of onset and the burden of the illness. The next one, we will see the resilience scale. And resilience is defined as the capability to return to previous functional level after dealing with stress. And from this study, we found that most of the residents had normal resilience at the beginning and even at the end of self-isolation period. This is actually concerning since resilience is actually a protective factor. So having high resilience is very good, since healthcare workers had higher risk of anxiety, insomnia, and stress-related symptoms, and resilience can serve as a protective factor. But however, for the socio-demographic factors, there's no significant correlation, meaning for the resilience and the anxiety, all of our population are all having the same risk of contracting anxiety and resilience. There are limited studies actually done for the socio-demographic factors prior to this. Therefore, our findings are new. And the third one being the Maslow burnout inventory. So in burnout, there's actually 3 dimensions of burnout that is covered by this questionnaire. The first one being the emotional exhaustions, the second one being depersonalization, and the third one being the personal accomplishment. So in our study, we found out that there's a low level of burnout in EE and DP, but there's most of our population showed high level of personal accomplishment burnout. This is actually interesting find, since when we compare to some previous study conducted to same healthcare workers, to nurses, medical residents, medical doctor, it shows that most of our health workers all around the world have higher MBI EE and DP, but low burnout on the personal accomplishment dimension. So our population shows very unique pattern than the rest of the world. And then the fourth one being the biological marker. Here we conducted a research since there's a theory that stress may lead to inflammatory response. So we conducted research using the neutrophil to lymphocyte ratio, interleukin-6, which is a pro-inflammatory cytokines, and CD4 cell count and cortisol. And we found some of them have significant correlation to our socio-demographic factors, such as here, the neutrophil to lymphocyte ratio shows significant with not the marital status. And then here we see the immune system baseline difference between genders. And the most interesting finding is difference between departments. This support our theory that different specialties have different work-related stress, in which anesthesiology represents the more extreme degree of psychological, intellectual, procedural, and logistical stress. And lastly, the severity of stress to our biological marker. We see here in the burnout, we see in the beginning of self-isolation, there's some correlation, there's significant correlation to PA and IL-6, DP, and CD4. And it showed the same pattern in which it peaked on the moderate burnout. Here, we see it peak in here and the moderate burnout also. And here also the anxiety. There's a pattern here that they peak on the medium or the moderate level. And after self-isolation, we also saw that there's a significant correlation to neutrophil lymphocyte ratio for MBI-EE. It supports our theory that long-term stress is generally harmful because it dysregulates bodily function. And here in the intervention versus control group, there is no significant difference between these two groups. So we concluded that the exercise-based intervention model is not effective, especially this meta-analysis also support that idea. There's no clear evidence for the efficacy exercise therapy in persons with burnout. So in conclusion, we got that 1 in 3 residents report high anxiety. Most of them have a normal level of resilience, yet high personal achievement burnout. And There are some potential biomarkers for anxiety and burnout, and cortisol showed no correlation to any of our variables. In conclusion, we hope that this finding helped to evaluate the impact of COVID-19 pandemic on frontliners' mental health condition, and further studies are required for the implementation of healthcare policies to ensure the frontliners' well-being, as they are very important assets in the COVID-19 pandemics. We acknowledge the limitation for our study, and thank you for listening. We are open to any questions.